machine is the one that gets set up out at the counter for knocking down patients. You're gonna wanna check the anesthesia level, the ISO level every morning, and make sure that it's filled up to that top white line. The ISO is kept usually in the pass-through, yeah, there's some there, and then we have a cabinet insert, pack and prep that has more. Dry. You're gonna take your mats and get them all set up. This mat that looks a little bit different than the others is the one that goes under the patient. And then you have these on either side of the table to stand on. One for you, one for the doctor. We take the blanket warmer. Thank you. I'll take a look today. That goes next. Then you're gonna have your bear hugger. On top of that, you don't wanna put the patient directly on this mat because it might get too hot. I'm not gonna set up the whole thing, but this would go, this goes over here, this tube comes and connects to the bed jet. And then we have our little table. I know.
Not enough room for all. It's not gonna have a beverage on the table.
So yeah, you'll run this under here. Sometimes you have to adjust the table, or if Dr. Downs is working, you won't be able to fit under there because the table is so high, so you'll have to figure out how to finagle it onto there.
How do you know what side of the bear hugger to face the patient?
Oh, that's a good question. You always want the logo facing up. It's hard. Your monitor goes right here. There's extension cords for everything. I like to run them underneath everything so that they don't get stuck. The doctors don't trip on them, or we don't trip on them. And you can set up all your leads. I like to clip them to this rather than this, because if this punctures, we have to replace the mat. The shoe glue doesn't work as well as we like to think it does. Get your pressure cuff, your blood pressure cuff, your leads, the SpO2, which connects to the anesthesia tube with the little, I don't think I have one in here currently, with the little white connector. Oh, and then you get your scrub ready. I'll show you how to do that. That's outside. And that's pretty much how you set up
And a
surgery.
puppy pad.
And a puppy pad, yes. A puppy pad goes underneath the patient as well. We have large and small. And we have 3 different sizes of bags. I think that sometimes gets a little confusing, but you want to pick the right one for your patient. I try to keep them organized, but sometimes they get all mixed up.
I have a question.
Yeah.
So